Hello everyone, my name is George Passion. I will be doing parts C and D. My partner Christy Murphy will be doing parts A and B. Our ethical debate is titled Nurse Advocates Against Terminating Treatment in Pediatric Cancer Patients. The decision to terminate treatment in pediatric cancer patients should be a decision nurses question and advocate against. As the patient's advocate, we have to remember the mental and physical exhaustion these patients and caregivers are under. According to Winland, Brown, Lockman, and Swanson, 2015, Provision 4 states, the nurse has authority, accountability, and responsibility for nursing practice, makes decisions, and takes action consistent with the obligation to promote health and to provide optimal care. Research regarding prior efforts used to solve this ethical dilemma is limited. However, a theory-informed, mixed method, thematic, systematic review with theory development was done to assist with finding answers regarding terminating treatment in pediatric cancer patients whose cancers are no longer curative. This review summarized 18 studies and included 8 legal and ethical guidelines. Authors Valdez Martinez, Noyes, and Bedolla, 2014. The conceptual framework used in this research was Howard's descriptive theoretical decision analysis model. This decision model determines what constitutes best practice, explores the evidence about decision-making, and identifies factors that facilitate or impede the decision-making process. According to Valdez Martinez, Noyes, and Bedolla, 2014, the range of decision-making issues identified point to the need to improve understanding of decision-making processes in the specific context for children and young people. Research findings were very beneficial and gave new insight into the decision-making process. Especially when decisions are so momentous, efforts to ensure decision-making efforts during critical times such as ending treatments would be very beneficial to healthcare professionals and organizations. As a patient's advocate, being certain decisions are being made without bias, barriers, burdens, or facilitators is the least we can do. The financial burden that accompanies ongoing treatment of rhabdomyosarcoma can be overwhelming to say the least. The decision to end treatment based on the inability to pay should not be part of the decision-making process. According to Winland, Brown, Lockman, and Swanson, 2015, Provision 8 states that the nurse collaborates with other health professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. Our proposal is to have a team comprised of social workers and case managers that specialize in pediatric oncology and end-of-life care. The team will also deal directly with institutions such as the National Institute of Health, the NIH, and coordinate with the patient and their family about new treatment options. The newly devised team will also keep in communication with the referring oncologist as well as the research oncologist. Responsibilities of the team will include referral outreach and helping to relocate patients and their families proximal to treatment facilities such as the Ronald McDonald House. Having a child with a potentially fatal disease is very stressful on parents, as you can imagine. Having a set of liaisons that can help broaden the treatment options can prove most beneficial. As with most proposals in a hospital, there are hurdles to overcome and a lot of moving parts involved. The conception of an idea often starts out of necessity. There are numerous cases such as the one of this 11-year-old patient and her parents. Proposals such as these are often brainstormed in nursing councils. A need is identified and sought for approval from management. There are a number of different stakeholders involved in a proposal such as this. Stakeholders ranging from leadership, whether nursing or medical, nursing educators, quality councils for policy reviews, and the chief nursing officer for final sign-off. Although often forgotten, the biggest stakeholders in situations such as these are the patient. The goal for any medical institution should